In field hockey, a drive is the most powerful hit or shot used in the sport. A ball can reach speeds of 100 miles per hour after leaving the stick depending on the skill level of the player. Drives are key on grass surfaces since more force is needed to make the ball travel a certain distance. Drives are also key during corners since a drive is hard for a goalie to defend. Defense utilizes drives to clear the ball out of the defensive circle and hit the ball up the field to their open teammate. Defense and midfield can use drives at a free hit as well. Offensively, drives are used to switch sides of the field and as a shot on goal. Whether a drive is stationary or on the move, both will incorporate a vast amount of muscles and joint movements throughout the entire body. In order to understand how the body functions as a whole, one needs to know and understand how muscles and joints are used together to create a sports movement. Starting with fingers, each finger has 3 joints, MCP, PIP, and DIP. The MCP is classified as a condyloid joint and allows flexion and extension. The PIP joint and DIP joint are classified as hinge joints, which allow full flexion and extension movement of the fingers. The thumb only has 2 joints, which is the interphalangeal joint for flexion and the carpometacarpal joint for thumb abduction. The wrist is classified as a condyloid type joint, allowing flexion, extension, abduction, and adduction. Wrist motions occur between the distal radius and the proximal carpal row. It's often referred to as the radiocarpal joint. The elbow joint is a hinge joint that only allows flexion and extension via the humeral ulnar and radial ulnar joints. The elbow is a hinge type joint that allows flexion and extension via the humeral ulnar and radial ulnar joints. Elbow is a joint that allows flexion and extension via the humeral ulnar and radial ulnar joints. Elbow motions primarily involve movement between the articular surfaces of the humerus and the ulna, specifically the humeral trochlear fitting into the trochlear notch of the ulna. Scapula, clavicle, and humerus serve as the attachment for most of the muscles of the shoulder joint. The shoulder joint is also known as the glenohumeral joint. It is a multi-axial ball and socket joint because it moves in all planes and is the most movable joint in the body. The glenoid labrum and glenohumeral ligaments help stabilize the shoulder joint. The scapula moves on the rib cage as a consequence of joint motion actually occurring at the sternoclavicular joint and to a lesser extent at the acromioclavicular joint. The sternoclavicular is a multiaxial anthodial joint and allows shoulder girdle to have a slightly gliding movement at the joint. Another anthodial joint of the shoulder girdle is called the acromioclavicular joint. This joint helps the shoulder girdle to do slight gliding and rotational movements. The last joint of the shoulder girdle is the scapulothoracic joint, which is just supported by the muscles that surround the shoulder. In the hip, the acetobulofemoral joint is a ball and socket joint created by the insertion of the femoral head into the acetobulum created by the innominate bones. This is a multi-axial, one of the most mobile joints in the body, and allows the hip to move during flexion, extension, internal and external rotation, abduction, and adduction. The innominate bones are union of the pelvis, ilium, and ischium. This bone connects anterior at the pubic symphysis and also connects posterior with the sacrum to create sacroiliac joints. The 2 knee joints are tibiofemoral and patellofemoral joints. The tibiofemoral joint is classified as a synovial hinge joint because it functions as a hinge moving between flexion and extension without side-to-side movement. The patellofemoral joint is classified as an antarthrodial joint due to colliding nature of the patella on the femoral condyles. There are many joints that make up the ankle and foot. The tibiofemoral joint, which is made up from the tibia and fibula, is classified as an antarthrodial joint. The bones are joined at both the proximal and distal tibiofibular joints. The ankle joint is known as the talocrural joint and is classified as a hinge joint. The talocrural joint is made up of the talus, distal tibia, and the distal fibula. Also, there are subtalar and transverse tarsal joints, which are classified as gliding or arthrodial. Lastly, the phalanges join the metatarsals to form the metatarsal phalangeal joint, which are classified as condyloid-type joints.
When analyzing various sports skills and exercises, there is a breakdown of 4 types of phases: stance phase, preparatory phase, movement phase, and follow-through phase. The stance phase allows the athlete to assume a comfortable and appropriate balanced body position from which to initiate the sports skill. The preparatory phase, often referred to as the wind-up phase, is used to lengthen the appropriate muscles so that they will be in position to generate more force during the movement phase. The movement phase is also known as the acceleration phase. It's the action part of the skill. This phase is the summation of force is generated directly to the ball or sport object. The follow-through phase begins immediately after the climax of the movement phase. It's also known as the deceleration phase. This is when the velocity of the body segment progressively decreases, usually over a wide range of motion. We will be assessing the field hockey drive within each of these phases.
For the stance phase, the fingers, both right and left, are in flexion, isometric contraction, using the flexor digitorum superficialis, the flexor digitorum profundus, and the flexor pollicis longus. The right wrist is in supination, isometric contraction, using the extender indicis, the extensor pollicis longus, and the abductor pollicis longus. The left wrist is in pronation, isometric contraction, using the extensor carpi radialis longus and the flexor carpi radialis. Both right and left elbow are in flexion, isometric contraction, using the biceps brachii long and short head, the brachialis and the brachioradialis. The right radial ulnar is in supination, isometric contraction, using the biceps brachii short and long head, and the supinator, and the left radial ulnar is in pronation, isometric contraction, using the pronator teres and the pronator quadratus. The right shoulder joint is in external rotation, using the deltoid posterior fibers, the infraspinatus, and the teres minor, and the left shoulder joint is in internal rotation, using the deltoid anterior fibers, the latissimus dorsi, and the teres major. Both the right and left shoulder girdle are in anterior tilt, isometric contraction, using the levator scapulae. The right and left hip are both in flexion, using the iliopsoas, the rectus femoris, the pectineus, the sartorius, and the tensor fasciolata. The pelvis is in anterior rotation, isometric contraction, using the quadratus laborum, the iliopsoas, the rectus femoris, and the tensor fasciolata. Both the right and left knee are in flexion, isometric contraction, using the biceps femoris, the popliteus, the semimembranosus, the subtendinosus, and the sartorius. The back is in flexion, isometric contraction, using the external obliques, the internal obliques, the rectus abdominis, and the psoas, and the ankle and foot are neutral.
During the prep phase, both your right and left set of fingers are performing flexion in an isometric type of contraction, using the agonist muscles of the flexor digitorum superficialis, flexor digitorum profundus, and flexor pollicis longus. Also in the wrist, both right and left wrists are performing radial deviation with a concentric type of contraction, using the flexor carpi radialis, flexor pollicis longus, extensor carpi radialis brevis, extensor carpi radialis longus, extensor pollicis longus, extensor pollicis brevis, and abductor pollicis longus. Within the elbow joint, you're also performing with the right and left flexion motion with a concentric type of contraction, using the bicep brachii, long and short head, brachialis, and brachioradialis. In the radial ulnar, the right radial ulnar joint will perform supination with a concentric type of movement, using the biceps brachii, long and short head with a supinator. In the left arm, the radial ulnar will pronate, using a concentric type of contraction, using the pronator teres and the pronator quadrates. In the shoulder joint, the right shoulder joint will perform external rotation in a concentric type of movement, using the deltoid posterior fibers, infraspinatus, and the teres minor. The left shoulder joint will horizontally adduct and internally rotate, using a eccentric type of contraction, using the teres major, teres minor, latissimus dorsi, deltoid anterior fibers, and infraspinatus. The right shoulder girdle will adduct, using a concentric type of contraction, using the trapezius middle and lower fibers and the rhomboids. The left shoulder girdle will abduct, using an eccentric contraction, using the middle and lower traps as well as the rhomboids. The hip. The right hip will internally rotate as well as extend, using eccentric types of contractions. Internally rotating, you'll use the gluteus maximus, your 6 deep ERs, and your bicep femoris. During your extension, you'll use your iliopsoas, rectus femoris, pectineus, sartorius, and tensor fascia. The left hip will externally rotate as well as abduct and flex, using a concentric type of contraction. With external rotation, you'll use your gluteus maximus, your 6 deep ERs, and your bicep femoris. During abduction, you'll use your gluteus minimus, tensor fascia, and gluteus medius, gluteus maximus. In flexion, you'll use your psoas, iliopsoas, your rectus femoris, your pectineus, your sartorius, and your tensor fascia. The back will rotate in the right direction, using a concentric type of contraction, using left external obliques, your right internal oblique, and your erector spinae. Your right pelvic will right transverse rotation in a concentric type of contraction, using your right iliopsoas, left external oblique, your right internal oblique, your right gluteus medius, your right gluteus minimus, right tensor fascia, and multifundus. The left pelvic will left lateral rotate in a concentric type of contraction, and use your iliopsoas, your erector spinae, your quadratus lumborum, your right external oblique, and your left internal oblique. Both the right and left knees will perform flexion using a concentric type of movement, using your bicep femoris, your popliteus, semimembranosus, your semitendinosus, and your sartorius. Your ankle and your foot. The right ankle and foot will slight invert and have a concentric type of movement using your muscles, the tibialis posterior, flexor digitorum longus, flexor hallucis longus, your tibialis anterior. And your left ankle and foot will perform plantar flexion to dorsiflexion right before the foot hits the ground. And you're also performing a concentric contraction using your gastrocnemius, your soleus, your tibialis posterior, and your flexor digitorum.
In the movement phase, the fingers on the right and left hands are both in flexion and isometrically contracting. The muscles being used are the flexor digitorum superficialis, flexor digitoris profundus, and flexor palpus longus. The right and left wrists are both in ulnar deviation to neutral with concentric contraction using the muscles flexor carpi ulnaris and extensor carpi ulnaris. The right and left elbows are both in extension. The right is eccentrically contracting with the biceps brachii, long and short head, brachialis, and brachioradialis. The left is concentrically contracting with the triceps brachii, long and lateral, and medial heads, and anconeus. The right radio-ulnar joint action is supination to pronation to neutral, concentrically contracting with the brachioradialis. The left is pronation to supination to neutral, using concentric contraction, again with the brachioradialis. For the shoulders, the right is an adduction and internal rotation, concentric contracting with the pectoralis major, upper and lower fibers, subscapularis, deltoid anterior fibers, latissimus dorsi, and teres major. The left is an abduction with concentric contraction with the posterior deltoid, latissimus dorsi, infraspinatus, and teres minor. The right shoulder girdle is an abduction with concentric contraction with pectoralis minor and serratus anterior. The left is an adduction with concentric contraction with the trapezius middle and lower fibers and rhomboids. Back is rotating to the left with concentric contraction with the right external oblique, left internal oblique, and erector spinae. The pelvis is in left transverse rotation with eccentric contraction using the right iliopsoas, left external oblique, right internal oblique, right gluteus medius, right gluteus minimus, right tensor fasciae latae, and mulfundus. The right hip is in external rotation and extension with concentric contraction with the gluteus maximus, 6 deep ERs, biceps femoris, semimembranosus, and semitendinosus. The left is in internal rotation and flexion with eccentric contraction using gluteus maximus, 6 deep ERs, biceps femoris, semitendinosus, and semimembranosus. The right knee is in flexion with concentric contraction using the biceps femoris, popliteus, semimembranosus, and semitendinosus. The left knee is in extension with concentric contraction with using the rectus femoris, vastus intermedius, vastus lateralis, and vastus medialis. The right ankle is plantar flexing with concentric contraction, gastrocnemius, soleus, tibialis posterior, flexor digitorum longus, flexor hallucis longus, peroneus longus, and peroneus brevis. The left ankle is neutral, it's stabilizing the leg.
During the follow-through phase, the right shoulder joint diagonally adducts and internally rotates with an eccentric contraction. The agonist muscles used during diagonal adduction and internal rotation are deltoid posterior fibers, infraspinatus, and teres minor. The left shoulder joint externally rotates with a concentric contraction. The muscles being used for this movement are also the deltoid posterior fibers, infraspinatus, and teres minor. Next, the right shoulder girdle adducts, also known as protraction, with an eccentric contraction. The agonist muscles are the trapezius middle and lower fibers and rhomboids. The left shoulder girdle adducts, also known as retraction, with a concentric contraction. The muscles being used for this movement are also the trapezius middle and lower fibers and rhomboids. Next, both the right and left elbow are in flexion with an eccentric contraction. They are both using the triceps brachii long, lateral, and medial heads and the anconeus for their agonist muscles. The right radial ulnar is in pronation with an eccentric contraction. The agonist muscles being used during this movement are biceps brachii, long and short head, and supinator. The left radial ulnar is supinated with an eccentric contraction. The agonist muscles are pronator teres and pronator quadratus. During the follow-through phase, both the right and left wrists are radial deviating with an eccentric contraction. The agonist muscles for both wrists are flexor carpi ulnaris and extensor carpi ulnaris. Throughout this phase, the right and left fingers are constantly in isometric flexion. The agonist muscles are flexor digitorum superficialis, flexor digitorum profundus, and flexor pallicus longus. The back is rotating to the left with an eccentric contraction. The muscles being used are the left external oblique and right internal oblique. The pelvis is doing left transverse rotation with an eccentric contraction and using the right iliopsoas, left external oblique, right internal oblique, right gluteus medius, right gluteus minimus, right tensor fasciae latae, and multifundus. The right hip externally rotates, adducts, and extends with an eccentric contraction. During external rotation, the agonist muscles are gluteus minimus, gluteus medius anterior fibers, and tensor fasciae latae. During adduction, the agonist muscles are gluteus minimus, tensor fasciae latae, gluteus medius, and gluteus maximus upper fibers. And during extension, the muscles being used are the rectus femoris, pectineus, sartorius, tensor fasciae latae, iliacus, psoas major and minor. The left hip internally rotates and flexes with an eccentric contraction. The muscles being used for internal rotation are gluteus maximus and the 6 deep external rotators. The agonist muscles for flexion are gluteus maximus, semimembranosus, semitendinosus, and biceps femoris. The right knee flexes with an eccentric contraction. The agonist muscles are rectus femoris, vastus intermedius, vastus lateralis externus, and vastus medialis internus. The left knee is extended with an eccentric contraction. The muscles being used are the biceps femoris, popliteus, semimembranosus, semitendinosus, and sartorius. Both the right and left foot and ankle plantar flex with an eccentric contraction. The agonist muscles for both are extensor digitorum longus, extensor hallucis longus, and tibialis anterior.
After breaking down the field hockey drive into 4 phases, joint movements, and muscular actions, you can see that a drive uses multiple body components to enable a player to execute a powerful and effective drive down the field.